What is a worldwide accepted course for treating corona, COVID? Is there a course which is, or at least let's say that, mostly most of the top doctors agree on this protocol?
For 85% of people, who won't drop their oxygen levels, who will stay at home, it's very, very straightforward. In the first week, generally, all you need is paracetamol. You need something stronger than paracetamol if the fever doesn't settle with paracetamol. There may be some role of inhalers, inhaled steroids, especially if you have a cough, if you're high risk. There are a couple of studies which have recently been done which suggest that if you're put on an inhaled steroid, maybe the progression is slowed down. Maybe you won't progress if you started on early. Apart from that, it's what you would do for any cold. Take a decongestant if your nose is blocked. If you're having body ache, you can use the same paracetamol. Some people get diarrhea, so use some sort of a probiotic if that's happening. Use some sort of a cough suppressant if the cough is irritating. Everything is driven by symptoms. So in terms of pathology, like what can we do to change the course of the disease, there isn't really much, unfortunately. Now, if towards the end of the first week, generally, if you're in that small 15% or so of people who drop their oxygen levels, that's where steroids, really make a difference. And that's the only place where one should give steroids if your oxygen levels drop. Steroids should not be used just to bring down the fever, or just to give a person a sense of well-being if they're having body ache, etc. That's not the right place to use steroids. If your oxygen levels drop, that is the right place to start systemic steroids. So that's their consensus is. Consensus is around oxygen. If your oxygen levels are lower than 92% or so, you definitely need oxygen. So nobody is going to say, let a person be. So there's clear consensus on the use of steroids at the right time. There's clear consensus on the use of oxygen. There's more or less clear consensus across the world that you should not be trying anything in the first week. So this whole laundry list of drugs that we seem to be using left, right, and center are pretty much used only in India. One of the big questions you should ask, or people need to ask, is why are these drugs, if these drugs are really effective, why is India the only country using this whole list of drugs, right? Why is it not accepted international standards to use these drugs?